Ma'am, we are live.
Yeah. Good afternoon, everyone. I'm Yogarani, physiotherapist from Chandra Rheumatology and Immunology Center and Research. We know this month is considered the Rheumatological Awareness Month.
Ma'am, one
Today,
second. One second.
yeah, yeah. Yeah, sure.
You are able to do right? Slide?
Yeah, yeah.
I will announce.
Yeah, sure. Yeah.
Ma'am, we are live.
Good afternoon, everyone. I'm Yogarani, physiotherapist from Chandra Rheumatology and Immunology Hospital. Today, we know this month is considered like a Rheumatological Awareness Month. In this month, I would like to give the awareness about some rheumatological condition. Today, my topic is holistic approach treating rheumatological conditions. So, before, we'll see what is rheumatology. Is the branch of medicine that deals with diagnosis and treatment of rheumatic diseases, including autoimmune disorders also. In that one, there are so many rheumatological disorders are there. So now I listed the two type of varieties. One is the inflammatory, one more is the non-inflammatory. Some example of the inflammatory arthritis is rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, reactive arthritis, enteric arthritis, gout. So under the non-inflammatory arthritis, osteoporosis, osteoarthritis, fibromyalgia, traumatic arthritis. These are the some example under the classification of inflammatory arthritis and non-inflammatory arthritis. Some of the arthritis are not that much the life-threatening one. Some diseases are like lupus, vasculitis, those things and all, it will give the more impact to the patient's health. So now I'm going to talk about the holistic approach, what it means. Because in the rheumatological conditions, not only treated by the medicine play a main role in it. But along with that, we have some other helpful, some other kind of like exercises, diet, stress management, lifestyle. These are the professionals also can helpful to come out of the patient in uh, some of the patient feels they can't able to do their daily activities, so they can't able to manage the stress. Some people for gout arthritis, diet is playing a main role. So in rheumatological disorder, in each and every condition having the different symptoms. So the holistic approach is very helpful to come out the patient from the symptom. They can lead the better healthy life. So along with the medications, you have to concentrate the exercises, diet, then stress management, then lifestyle. Now we'll see the role of physiotherapist in rheumatological conditions. Because in rheumatological conditions, the main symptom is the pain, swelling, stiffness. Due to the stiffness, the patient can't able to do their daily activities like combing the hair. They can't able to open the door. They can't able to open their water bottle. The small things also, they will be very difficult for their task. So in this kind of situation, physiotherapy holds a main role on it. Before that, we'll see the principles. Before planning the physiotherapy management program, we have the some principles how we have to design the protocol for patients, because each and every patient have the unique symptoms. So we have to take a full assessment of medical as well as the physiotherapy assessment. Accordingly, we have to go for the protocol for the patient progression. So first we'll see the principles. What are the principles we have to see before starting the physiotherapy program? First, we have to establish the medical status. The patient's anemic conditions, osteoporosis, any heart diseases, then Atlanta axial subluxation. So why we are telling the AA subluxation means rheumatoid arthritis, you all will know it affects all the joints. The AA joint is the first our cervical joint. It will affect that joint also. If it's the chronic case of rheumatoid arthritis patient, they have the chances of happen the atlantoaxial joint subluxation. So in that condition, we can't able to give the cervical traction on her. So before taking a case, before treating the patient, making a protocol of management, we have to see the medical status. It is very important. So then the blood parameters, how their inflammatory parameters, ESR level, CRP, those things and all we have to see. Then how they are taking the medications. They are taking the medications on the regular basis, otherwise the irregular medications they are taking, how frequently they are using the NSAIDs, then steroids, how they are taking. So all the history also have to be collected. Then assess the patient properly. Identify the joint. How many joints has involved? How many joint is stiffness? How many joint has the swelling? Accordingly, we have to plan the management program. So first see the type, number, the severity of the joint, then go the protocol. Then again, range of motion. Because in rheumatological conditions, pain, swelling, stiffness is playing a major role. So patient mainly affect the range of motion. So we have to assess the range of motion before starting the PT protocol. So now we'll see what are the goals. Because first our main role is to reduce the pain, then get the joint range of motion, reduce the swelling, then muscle strengthening, joint preservation, and improve the ADL activities of the patient. So joint range of motion is a very important, because if the pain is there, the patient won't move the joint for quite long period. They are not do the full movement, full range of motion. So at if the one patient have the pain in the elbow up to the 40 degree, so they won't move beyond that. So in that condition, we have to tell the patient to move the joint at the full range. So joint range of motion is the main goal of PT management. Then reduce the stiffness, muscle strengthening. So each and everything we have to make a goal. Accordingly, we have to assign the exercise for the patients. So range of motion. How we can get the range of motion? Because if the patient have pain in the shoulder, the patient can't able to do the full range. So in that case, how we can get the range of motion? In the train, we have to do the passive range of motion. Passive range of motion is nothing but the movement has to be done by physiotherapist. Once the passive range of motion is increased, along with the physiotherapist will teach the some active range of motion exercises. Is nothing but patient has do on their own. So first passive range of motion followed by active range of motion. How we can improve the passive range of motion? Because when the pain is more, the patient can't able to move the joint very easily. So for that, we have to give the some pain relieving modalities like IFT, wax, hot pack. Those of the modalities we have to give. We have to get down the pain threshold down. Then we have to start doing the exercises. So first, if you are doing start the exercises, it has to be gone within the pain-free range. Then gradually we have to increase the range of motion. If what are the exercise we taught, the patient has to do at least twice a day. So 10 to 15 movements they has to do per session. So that if you start doing the exercises, the slowly the pain will come down. So the next day the pain won't worsen. Also, the movement will be very free. So how we can get the active range of motion? If once the passive range of motion comes, the patient can able to do with the some assisted devices like on their own body weight. For example, the patient having pain on the right hand, with the help of the left hand, they can able to lift up the things. Then with the bands, bands, or some kind of the sticks. So for the more assistive devices, the patient can improve their active ranges. So at least twice a day, they have to do the exercises. So why strength training is important? For example, in rheumatological condition, in arthritis, in chronic cases, there will be the muscle breakdown will be there. In that one, the muscle weakness will happen for the patient. So for all the rheumatological conditions, we have to see the muscle strength also. How we can teach the muscle strength? First, we have to assess the patient in their capacity, 30 to 40% of the weight we have to tell the patient to use for strengthening program. Then first, initially, if they started the exercises, they have to go with the non-weight bearing exercise. For example, in the sitting position or otherwise the lying position, we have to teach the exercises. Then strengthening, if you do the strengthening program, it will improve the bone density, then minimize the pain. They can be able to do their aerial activities better comparatively before. For example, before starting the strengthening program exercise, the patient can't able to open the door also. After started the treatment, they can able to open the door very easily. So the muscle will go for strengthen. The muscle can do their action very easily. So strengthening program is very, very needed for traumatological patient. So why aerobic training? Because in rheumatological conditions, so in all the patient, maximum ESR and CRP are like the inflammatory parameters are in the elevated side. So for that, increase the blood viscosity will be there. So the some of the heart-related disease they can grow very easily. So in that case, we have to educate the patient to do the aerobic training exercises like it's nothing but walking, cycling, jogging. These are the exercises we will call the aerobic training exercises. So what it will happen? So it will reduce the less pulmonary fibrosis, then less mobility. It will improve the muscle strength and stamina. So the patient can be able to do their activity. If aerobic exercise, if you are doing the small muscle as well as the long muscle, both the muscle also will work in that one. So the patient can activate the whole overall body, all the muscles and as well as the joints. So it will improve their flexibility as well as the muscle also will go for the strength. So joint preservation. How we can preserve the joint? First, the patient has to, these are the points they has to keep it in their mind as they will do their daily routine, otherwise the exercise also. Respect the pain. First, we have to, before starting our daily activities as well as the exercises, we have to think about the pain. If the pain is more, don't do the exercise like 20 counts, 30 counts and all. Instead of doing the higher repetition, go with the a small number of repetitions only. 5 to 10 count is enough for that day. If the pain is not there, you can go with the higher repetition of the exercises. If you are having the set of task in 1 hour, you just plan half an hour, you just do the what are the daily activities, routine work, then take a break, then again you go with the other works. So first you just think the pain. So according the pain, you just plan your day. According the pain, you just balance the activity. If you're walking for daily 1 hour, so today the pain is more, so you just go for the 15 minutes walk, take rest 10 minutes, then again you start your walking. So according the pain, you just plan the exercises as well as your daily routine activities. Avoid the stillness. Why we are telling to avoid the stillness? Because in rheumatological conditions, the swelling stiffness is the major symptoms. If you are sitting for a quite long time, otherwise if you are not moving the joint for a quite long time, it will go for the stiffness. For that, you just don't if the pain is there in one joint, you just to move the joint at least 2 or 3 sets within 2 or 3 hours. Every 3 hours, you just to move the joints. Move the each and every joints. Then the stiffness won't happen very easily. So the joint alignment also we have to maintain. If you are sit in the chair, you have to sit erect. If you are the slouch posture, if you are sitting, it will affect the backbones, then muscles, then ligaments, everything will go for the strain. So body alignment is very, very important. Then one more thing, maintain your body weight. For example, osteoarthritis patient, the major pain on there in weight bearing joint of the knee. If the patient get if the patient increase the weight more, so it will be very strain on their joint. Then their activities also they can't able to do very easily. They can't able to walk very freely. They can't able to climb the stairs. So in that one, we have to mind our weight first. So maintain the weight. So only in the rheumatological condition, as I said before, it is not only about the medicine, exercise, and all. It is the one holistic approach. So we have to manage our stress also, because if the stress is more, our immune cells will go for aggressiveness. For that, the symptoms also will be increased. So we have to do some of the medications, breathing exercises, yoga. We have to calm our mind and we have to know how to manage our stress. So, at least daily half an hour, you just do the breathing exercises, yoga therapy, along with your daily routine activities. So, yoga therapy and counseling is play a major role in the rheumatological conditions, like mainly the fibromyalgia conditions and all is a stress related one. In that one, you just do the yoga therapy. Regularly, that the stress will come down, that the symptoms also won't flare up. So counseling, why it's very needed? Because if one lady patient, if they have that work as well as their household activities, along with the pain, they can't able to manage that task. They can't able to fulfill the task on the correct time, on the correct basis. So in that one, what happened? They will go for the stress. So in that one, counseling is very, very needed. How they can come out of the stress, how they can maintain the pain, then how they can lead their life along with the disease symptoms. So counseling and yoga therapy also play a major role in treating the rheumatological disorders. So what I'm going to educate the patient, each and every patient needs the education. They has to know what is the disease manifestation. If the patient having the rheumatoid arthritis, they has to know what are the disease manifestation. Like they having the swelling, if it's sometimes stiffness, sometimes deformities. So these are the clinical features and symptoms they has to know. So then progression, how we to go progressions. Each and every stage also we have to educate the patient. If you are not doing the exercise on the initial stage, the stiffness will develop, will turn into the deformity. Stiffness we can revert it back at least to the near to the normal level after doing some physiotherapy exercises, some yoga, stretching exercises. So we can revert back to near the normal level. Once the stiffness is turned to the deformity, we can't able to revert it back. So before the progression of the symptoms, we have to, in early stage only, we have to stop it. So according the doctors, physiotherapists, so other professionals, what they are telling their protocol of management, you have to follow, then you can come out of the very like a deformity stage and all. Okay. So some patients will have the remission and relapse will happen in rheumatological disorders. Sometimes there is the no pain only. Sometimes the pain will be go for the peak. So according to that one, as I said before only, respect the pain and plan your day. So accordingly, just to plan your task, plan your daily routine activities and exercise protocol also. So medications. Because in rheumatological disorders, we have to take a medication quite long period of time. So we have to prepare our mind. We have to take the medication as per the doctor as per advice. How long they are going to tell how long you have to take a medication until those period you have to take a medication. Then if you have any doubt of eye effects and side effects, discuss with the doctors. They will clarify all the doubts. Don't stop the medications in the mid of the management protocol. So if you done the thing, the disease will go for progression very easily. Then you will get the deformity. So other the organ involvement. These are the things will happen. So blood parameters. Why the blood test is very important in rheumatological conditions? Because we have to see the inflammatory parameters like ESR, CRP, everything we have to see. Accordingly, we can manage the, we can plan the management. Then exercise is the major role. Why we are telling? Because in the rheumatological conditions, pain, swelling, stiffness is the major role in major symptoms in rheumatological condition. If we take that myositis, the muscle weakness will be there. So in that one and all exercise play a major role. So along with the medications, do the exercises regularly and lead the healthy life. So lifestyle also very needed. All the rheumatological conditions, all they are not in specific diet and all. Only the gout is have the but diet play a major role. In other conditions, you have to maintain the body weight and all. So you have to you have to see that diet also. So mental health is very important to maintain the stress level and manage the pain along with the symptoms, how you can lead that life. Then medication is the very important. You have to take the medications regularly and do the exercises and maintain the proper diet and do the yoga. So all the all the way, if you are planning and do the things properly, you can easily come out of your problem. Then you can maintain the symptoms and you can lead the healthy life also. So please listen the doctor's words, what they are telling. You just to follow how long they have to take the treatment. Please take the treatment from the physiotherapy side. What they are telling the exercises, do the exercises regularly. If the pain is more, you just consult the physiotherapist. How much the dosage you have to do in the exercises? How I can go further? Don't stop the exercises. There will be always the alternate solution will be there. So if pain is more, again consult the physiotherapist and do the exercises and prevent the stiffness and deformities. So, so please mind the things in rheumatological patient. All you just take the medication properly, do the exercises, take a proper diet, and do the yoga and medications and not do the lead the healthy life. Thank you.